background. So we learned how to take blood pressure last week, and the current guidelines, and yes, they have changed, is that a normal adult blood pressure is below 120/80. They're now saying it should be less. Hypo means low, so hypotension is chronically low blood pressure, so not situationally. There is something orthostatic hypotension where people just have it when they changed or when they get up quickly. The receptor reflex is supposed to help that. You guys can feel your own receptor reflex. So tomorrow morning, after you lay down, put your fingers on your carotid pulse and then get out of bed. What you're going to feel is increased heart rate rather dramatically and an increase in contractility. You've probably all experienced where you got up too quickly and might have felt a little head rush. That you got up faster. Gravity was pulling faster than your baroreceptor reflex could maintain that. Okay, so that little head that you may feel. This increases as people age, so definitely your elderly patients, you want them to get up and out of bed more slowly to reduce the risk of falls. But hypotension is chronically low. That's a systolic pressure below 90 millimeters of mercury and or diastolic below 60. But someone's going to feel fatigue, tiredness, dizziness, fainting, and when they faint and lay down, that restores venous return. Hypertension, and we're talking about hypertension when you hear that term in the systemic circulation. So they have pre-hypertensive, you're between 120/80 to 130, but 130/80 to 139/89 is stage 1, and then greater than 140/90 is stage 2. Yes?
What does that word orthostatic mean?
Orthostatic. So ortho, like if you go to orthopedic, has to do with your limbs, so change to position. So static means to say, but like if you go from sitting to standing, is usually when people have a drop or if they have to stand in one place for a very long time. They cannot maintain venous return. Hypertension is called the silent killer because often people do not realize that they're hypertensive. There's no real symptoms to it. I know personally, turned 40, had hypertension. All the way stage 2. Was a runner, healthy, here's your pills. Didn't know. Just the repeated, hey, this is kind of high, this is kind of high. And no, it's not high. Took it for 2 weeks, all right, it's high. And so I'm going to kind of go through, it increases risk for heart disease and also for stroke. And so we're going to kind of talk our way through that. Primary or essential hypertension, in honesty, there is no one thing that causes it. There's no if we just fix this one thing, no one's going to have hypertension. There are risk factors that place people at risk for hypertension. If someone is overweight, then they are going to increase blood vessel length, so it increases peripheral resistance. If someone has a high salt diet, they will tend to hold on to more fluids. Usually that's why they say, hey, cut out the salt, because we learned that increased blood volume increases blood pressure. A high-fat diet is more likely to lead to atherosclerosis, and so those clogged arteries, and this is a narrow lumen, so that raises blood pressure. Stress is going to increase blood pressure, right? Because somebody's stressed out, they're going to have an increased heart rate and contractility and stroke volume. Smoking is just horrible. We'll just leave it at that. It has a horrible effect on the cardiovascular system, also raises blood pressure. And 2, just being sedentary and the aging process, people's blood pressure tends to go up. So when somebody comes in, if they're pre-hypertensive, they'll just say, okay, let's look at your lifestyle, right? Okay, you need to start exercising. Let's change your diet. More grains, more vegetables, less fats, less meat. And that's the first option. Like I said, when I went in and I was 139/90, 143/92, I'm not overweight, I don't smoke, I was a runner, I eat right. There's no discussion. It was here's your pills. And once you're on medication for hypertension, you just never get off of it. So mine is an angiotensin converting enzyme inhibitor. And we know angiotensin, tension, and then also we get aldosterone. And so it stops that increase of blood volume. So that's just one type of drug. Okay. All right. So the reason it's a silent killer and its effect on the heart, so I just kind of want to connect this to heart disease. So we said that bad things add to afterload of the heart. So if there's more pressure in the vessels, that means that left ventricle has to work harder to eject blood into the systemic circulation, right? And so hypertension is afterload. The body still demands cardiac output, so the heart has to adjust, okay? So it has to beat harder, okay? And so you're gonna get the enlargement of the heart. Whew. So this isn't the type of enlargement that comes from, you know, running or being fit. So what happens is the heart enlarges. And what happens over time, though, the muscle wall, it gets more flabby than strong, but it's enlarged, and so eventually it weakens. So now you have an imbalance, because remember, the right side of the heart pumps to the lungs, to the left side of the heart, and then the left side pumps to the systemic circuit, and then it comes back. And so now you've got left side, that left side is weakening. When that occurs, we've got pulmonary venous return, so the amount of blood coming from the right side is greater than the amount of blood leaving the left side, okay, because this side's weaker. Okay, so what's going to happen? Where's the blood going to go? Because blood is just fluid. It's a fluid, so it's not leaving here like it's supposed to because we have a pressure going this way. So where do you think it's going to go? So it's going to back up. Well, it's just a fluid. So this side's pumping. It's doing its thing, normal cardiac output. This side is now weaker. So there's a mismatch. So now we have a backup. So now there's more pressure in the lungs. There you go. So then you get what's called pulmonary hypertension. Okay, normally the pulmonary circuit is very low pressure, right? Because it's just going to the lungs and back. It doesn't have to be very strong, and that's why that right ventricle was smaller. So now you have pulmonary hypertension, which is defined as greater than 25. Normally this does increase normally during exercise, but like I said, this is because of this side is failing, so now blood is going to back up into the lungs. All right, so now what we have is now we have excess volume in the lungs, so that's going to increase pressure. So now the right side of the heart has to generate enough force so blood leaves that right ventricle and goes into that circuit. So it's going to respond the same thing. So the myocardium is going to enlarge, and over the course of time, then it weakens, and then it's going to fail. So now where's the blood going to go? So now there's blood coming back, but it's not leaving that right side, so it's backing up. Yeah, exactly. So now it's in the veins. Okay, so with congestive heart failure, okay, the symptoms that you see, there is an enlarged heart. It's called congestive because there's excess fluid in the lungs. You've got pulmonary hypertension. Okay, so now you have fluid in the lungs, and that's why someone who has congestive heart failure, they do not like to lay down. That makes it very difficult for them to breathe. So they'll often, sleep sitting up. They may too, because we don't get great gas exchange with congestive heart failure, so may have cyanotic or see blue in the lips. Also, you've got backup from the right side failure, so now you've got swelling. So that backup to the veins, you end up with swelling. And so those are a weakness of the heart that leads to buildup of fluid in the lungs and surrounding body tissues. And so that's how hypertension can lead to congestive heart failure. Okay, so anything that makes the heart work harder, you ultimately will get to this backup of fluid if it progresses that far. And this would be measured just, there would be a lower ejection fraction. This isn't an overnight thing. Okay, it's over the course of time, and so it's a silent killer. Yeah. So that's what you see with congestive heart failure. So I just want to kind of connect that to heart functioning and how does a patient get there, and why hypertension needs to be controlled. All right, other vascular problems. So veins have valves. So we said that, and particularly in the lower extremities, or in the extremities, so arms and legs. And when they're working, they prevent backup. What can happen in the case of varicose veins, remember the walls are thin, and if a valve, an incompetent valve, doesn't close, and so then you've got excess blood in a section of a vein, and the wall swells, and so you get varicose veins. And so varicose veins are caused, you see the superficial ones are caused by incompetent valves. If you've heard of hemorrhoids, they're basically varicose veins in the anal rectal region because of increased pressure on that venous system, particularly when straining if somebody is chronically constipated. Vessels can also have weak spots in the wall, and so an aneurysm is an abnormal ballooning of an arterial wall, and usually these are going to be the elastic or muscular arteries because they're under the most pressure. And I don't know if you're, it's always what I think of, sorry. If a wall thins, its pressure is going to, has to come out somewhere. There's aortic aneurysms. Usually people do not know they have these, and then they can burst, and then it does cause death because somebody bleeds out before anything can be done. It can also happen in the brain, and so that would cause a red stroke. Like I said, they can rupture, cause internal bleeding, stroke, and they can be fatal. All right, so I kind of put this at the end because we talked about a whole lot when we were talking about blood and heart, and like I said, it's the number one killer is going to be cardiovascular disorders. And like I said, I sort of left that. I think all that we added on this one, we talked about aneurysms and varicose veins, plasma volume issues. I just threw that in there. So kidneys are responsible for blood volume. I'll connect that in Unit 3. But everything else we kind of talked about, and kind of put all on one page for you.